Okay, let's do this. I think I'm all ready. Okay. Cynthia, I got a question. I'm 65, still working. What should I take? I have health insurance through my company. You don't need anything. If your company has 20 or more employees, you can stay there. You don't need Medicare A or B. Call us when you do want to retire. Will your company take a list of my meds to advise what plan to go with? Yes, we need a list of your drugs, your dosages, your doctors, your zip code, a lot of other personal information. If you need an appointment, go to the MedicareFamily.com. Mercy Angel got my book. Did you read any of it? I got it right here. Da-dun-da. I decided I'm going to give a bunch of copies to my square dancing group tomorrow, even though most of the people are like over 70. But you know, RMDs don't start till 73, so gotta give my books away. This is an ugly hat. I've never liked this hat. I have no idea where it came from. It's like plastic, but I kind of felt like it went with my Harley Davidson t-shirt. Mickey, can you tell me how much Medicare Part D is? Nobody can tell you that. Depends on the medications you take, your dosages, the state that you live in. Susie, how long do you have to be married for the spouse to collect? Only 1 year. Okay. I will tell you guys a story about my Van Halen t-shirt, because my husband, he was married briefly when he was young, but the lady was like 20 years younger. So when we got married, when he's like 50, he's like, it's so cool that we like the same things. Like we both like the same bands. Like, yeah, because we're the same age. Mr. Pervert marrying a young person. He's a sweetheart. But how long did we be married for the spouse to collect? Only 1 year. Ex-husband, he's on Social Security. We're married 28 years. Best friend still. I'm 64. He's 70. Okay, if you want to draw Social Security off of an ex-spouse, if the marriage lasted at least 10 years, if you're not currently remarried, you can get the maximum amount at your full retirement age. You were not at your full retirement age. You were only at 63. Click on the link in my bio to get my Social Security and Medicare cheat sheet. In the bottom right-hand corner, it will show that if you draw at 63 and you draw a spousal benefit, you will get 70% of 50%. 50% is the maximum amount you can draw as a spouse or an ex-spouse. So if you do the math, you're like, maybe I'll wait a little. Maybe I'll wait a year or two, or maybe you want it right now. Fantastic, Mercy Angel. Is it true that everyone needs to sign up for Medicare by 65? That is not true. Everyone's situation is different. So the majority of people need it, but not everybody does. Cynthia, I won't get penalized if I don't pick either since I have health insurance at work. Nope, no penalty, no problem. As long as your company has more than 20 or more full-time employees, it can actually be part-time, but I like to say full-time. No penalty, no problem. Look at this heart. Thank you so much. Tracy Lynn, I was just approved for disability. Do I need to do anything? It'll take 2 years before you're approved for Medicare. And that's when we can help you. Ginger, can I draw widow's Social Security if I'm already getting his retirement pension? If he dies, yes, you could switch up. It's your choice when to switch up. You get a higher amount when you do that. Thank you, Maui. I actually brushed my hair for you guys. Was the first time all day that I brushed my hair. Yes, so I brushed it for you guys. I had it in a ponytail. Thoughts on MAPD PPO? Miguel, it depends on specific your situation. Where do you live? What's going on with your health? What doctor do you need to go to? What's your budget? What plans are available in your area? PPOs are going away. If they're still available, the benefits are getting worse. The prices are going up. The whole Medicare Advantage market wants to shift everybody to an HMO plan. That won't happen overnight. But over the next 4 years, you'll see fewer and fewer PPOs even available. The plans that'll be more attractive will be HMO plans. Metka, I was told I turned 66 in November, then in January I could draw my Social Security without a cap. I don't know who told you that. Hubby turning 64 and willing to work. I'm 56 on my insurance. Should he wait for Medicare? If he can stay on your insurance at 65, it might be better. About 50% of the time, it's much worse than Medicare. So I actually have a bookmark in my book, Medicare Mama's Guide to Medicare and Social Security Retirement. On page 88, it will help you do the workbook and tell you, should you stay on your work insurance? Should you go to Medicare? You have to fill in the blanks on the workbook, how much it costs to keep him on your plan, what the deductible is, what the copay is, blah, blah, blah. But about half the time, he's better off going to Medicare. Half the time, he's better staying there. I've taken early retirement. Will I be taxed? If Social Security is your only form of income, it is not taxed. If you are single. How does HSA and Medicare work? Matt, once you are eligible for Medicare at 65, you could be under if you're on disability. You cannot contribute to an HSA. Your employer cannot give you that sweet employer maxing contribution unless you do not have Medicare Part A or B. Everybody screws this up. They take A because somebody told them to, and now you lost the tax deferred benefits of an HSA. So do not do that. It's actually quite complicated, which I wrote the book for you guys because it's a minefield. So at 65, don't take A or B. And then you want to continue to work. And you don't know when you want to retire. But you have to plan ahead, because when you're over 65 and you sign up for Medicare, they retroactive Part A back 6 months. So that's why the secondary rule that's extremely confusing with health savings accounts is that you have to stop contributions, you and your employer, 6 months before you plan to retire. You're like, I don't know when I want to retire. Well, you better plan it out. I had a lady today say, I just got fired. Well, now you got a problem. Your accountant can try to work that out, can try to back the contributions back out. You can get your employer to issue you another W-2. It is possible. It is also a pain in the butt. My husband has Humana Medicare. Will it pay for compression socks? No. Medicare pays for durable medical equipment, things that can be reused, like this plastic glass can be reused. So something like adult diapers, probably not a good example. Compression stockings cannot be reused by somebody else. Many Medicare Advantage plans give you a little bit of money every quarter to buy things like that. Don't know what your question is. Thank you for sending me the sunglasses. Kay Crane likes my hat. Thank you. Does leasing your farm count as earned income? No. If I'm giving $5,000 to the first 5 people to message me, okay, fantastic. Let's get somebody blocked here. Always fun. Start out. And I guess now nobody gets to win the fun $5,000. JB, my wife is Chinese citizen, married 20 years. When I pass, she moved back to China. Will she get the Social Security? If you were only married 10 years, she's a Chinese citizen. I'm not sure. I'm a little bit tired right now. Metka, wouldn't you get that as part of your drug or whatever my mother had? Don't know your question. Is stock dividends non-claimable for Social Security disability when filing taxes? Yes. How much is your book? The big workbook, which is 360 pages, it's 7 by 10, is $24.99 on Amazon. If you want to get it on Kindle or the Audible book, the what do they call the Audible books? That is $9.99. Go to Amazon, in the Amazon search bar, type in Medicare space Mama, M-A-M-A. It will pop up. You'll have it in 3 days. My mother's getting total knee replacement surgery. Is she eligible for a rehabilitation center? I do not know what type of insurance she has. Michelle, I don't have a link to the book. Just go to Amazon. In the search bar of Amazon, where you would normally type in, like, I need a garden hose, you type in Medicare space M-A-M-A. It will pop up. How soon do I have to apply for Social Security? 4 months in advance. Do I have to accept Medicare? No. Working full time. Can I take my husband just for a couple months until full retirement? Yeah, you can do that. Can I retire at 64? You can take your Social Security early. You can't get Medicare early. So if you have health insurance through a spouse that can get you to 65, if you want to pay for Affordable Care Act, which is just the price, not affordable, yeah, you can retire at 64. Some people retire at 64. They don't have a spouse insurance. They don't have uh, any plan to go on the Affordable Care Act because it's so expensive, but they take money out of their 401k, out of their IRA. Aetna Advantage plans. You guys should start receiving this week. You should start receiving your annual notice of change letters from your Medicare Advantage companies and your Part D drug companies. People have started to tell me what they're seeing, and as I warned you, it is going to be a raise. You're gonna pay more. Fran, I worked with John in your office. Great experience and recommendations. Thank you, Fran. I appreciate that. Just not a good time. What if I got a job after taking Medicare? Can I switch employer? Yeah, just terminate Medicare. Google how to terminate Medicare. It's a form, CMS-1763. Terminate it, get it back later. So you need Part A, Part B, supplement, and drug plan, Advantage plan. Yes. Brenda, you either go with government Medicare, A and B, buy a supplement and a drug plan, maybe a dental plan, or you go with private Medicare Advantage, which rolls A, B, and D all in together, and you wouldn't buy a supplement. If you guys need help with that, go to our website, themedicarefamily.com. 3 generations of my family have been helping people with Medicare for 45 years. My parents started 45 years ago. I've been doing it for 30 years. Go to our website, themedicarefamily.com, whatever state you're in. We're licensed in all 50 states. We work with dozens and dozens and dozens of insurance companies. The name to type in, Michelle, is Medicare Mama, M-A-M-A. The title's really long. It's Medicare Mama's Guide to Medicare and Social Security Retirement. Just type in Medicare in the search bar for Amazon, space M-A-M-A. It will pop up. Jabby, I'll be 64 in December, work full-time. When should I start drawing Social Security? Do not draw Social Security until you no longer work full-time or you reach your full retirement age, which is going to be closer to 67. If you don't know your full retirement age, click on the link in my bio, click on my face with a pink circle in it up here, click on my face when it pops up down here. The link in my bio will have my Social Security Medicare cheat sheet. This will tell you based on the year you were born, what age you receive your full retirement. It will tell you if you draw early, what percentage reduction you lock in. Down in the bottom right-hand corner, it will tell you if you draw as a spouse early, what percentage would you get? If you draw as a surviving spouse early, what percentage are you locking in? It is free. I'll be 64 in December, work full time. If you guys are new here, there's a heart to follow me. If you're over here, a heart with a thing. I don't know how you follow me over here. There's follow me somewhere. But if you want to learn about Medicare, follow me, subscribe, whatever they tell you, whatever it does. Brian, Advantage is a scam to funnel taxpayer money to insurance companies. Thank you for your little soliloquy. Does it make sense to enroll in Medicare Part B if still working full time? I wouldn't do it. It's a lot of money. If you're working full time, you have insurance, your company has over 20 employees, I wouldn't pay for Medicare Part B. You're paying next year. Right now, Medicare Part B is $185 a month for the average person. It's going up to $206.50. It's going up 11%. It's a lot. So if you don't need it, I don't know why you would want to pay for it. Pick up Medicare Part A at 65 if you don't have a health savings account. Make sure you understand that. Pick up A or don't pick up A. But don't get B until you need it. Missy, does it make sense to enroll in? Okay, I just got you. Continuing to work after 65, part-time company insurance will be penalized when I decide to get Part B. No. If I'm working full-time and collect Social Security, what kind of taxes will I have to pay? They have not changed the tax brackets since they started taxing Social Security in the mid-'80s. So if you get my Social Security and Medicare cheat sheet, it is on the back, top third of the page, and it will tell you that if your only income is Social Security and you're single, you don't pay any taxes. If you're single and your income from all sources, meaning half of your Social Security and everything else, your pension, your interest, your dividends, your part-time job, if that exceeds $25,000, you will pay taxes on 50% of your Social Security. If it exceeds $34,000, you will pay taxes on 85% of your Social Security. This is free. Click on the link in my bio to get it. Up here, you click on my my face with the pink circle, then my face down here, put in your email, you will get it. Anybody that does download my free Social Security and Medicare cheat sheet, when I update this every December, the new numbers for the next year, you will automatically get it by email from me. Many insurance plans like Oxford will penalize members for not enrolling in Medicare Part B if they still work. Insurance companies do not penalize you. I don't know what you're talking about. Can you piggyback off ex-spouse working credits for Part A if you don't have enough? Yeah. So let's say I'm a stay-at-home mom. I have never earned any credits towards Social Security and Medicare. It's okay. I will earn the right to draw Social Security and Medicare A and B via my spouse's work record, as long as my spouse qualifies. Red, has taxes on Social Security due to the big beautiful bill been reduced or eliminated? No, and also no. So the formula to determine how much of your Social Security, it's on the back of my Social Security Medicare cheat sheet. It is right here. It has not changed since I think it's 1983. But it was not changed by the one big beautiful bill. The one big beautiful bill merely gives an additional tax exemption to some, but not all retirees. If you're on Social Security, you can be on Social Security. It's 60 if you're a widow, 50 if you're a disabled widow. A lot of people draw Social Security at 62. This new tax exemption only starts if you're 65. So from 65, now it looks at your income. If you're under $75,000 gross income as a single filer, you can get the extra $6,000 tax exemption. If you're 65, married filing jointly, and your gross income is under $150,000, you can get the $6,000. Again, this extra exemption is only for 3 years, so it already has an expiration date on it. So it is not. Paul Jackson, and to get on the mailing list, to get on my mailing list, and I send an email every week. The first time you sign up, I send you an email every day, and then it's only once a week. Merciful. But click on my face up here. If you want you'll get my Social Security and Medicare free cheat sheet, and then that'll put you on the mailing list. So if you don't want the weekly newsletter, scroll to the very bottom. There's an unsubscribe. We will never, ever email you ever again. So there's my face up here with the pink circle. Click on that a couple times until my face pops up in the bottom down here. Click down there, put your email in. You'll get this immediately, and you'll be on our mailing list. If I retire at 62 and want to continue to work, how much Social Security will I pay? Thank you, Vico. Did I hear you say, is it for single people as well? Yes. Why do they make this so complicated? I know. When doing my Social Security in March, can I still work, or do I have to quit my job? I don't know how old you are. If you're at your full retirement age, there's no conflict. Do you know how the 55 plan for 401k withdrawals work? Not every 401k administrator allows it. So you have to check with your plan administrator. Most don't, but if they do, they will allow you to take money out of your 401k at 55 without a penalty. Typically, you can't take it out till 59 and a half. So some administrators make you take the whole amount out, which is a tax nightmare. Some will allow you to have flexibility. Again, not all employers allow that. Check with your employer, whoever administers your 401k plan. If you guys learned something tonight, there is a heart. Will you please give me a follow? I don't know how you could be in my live and not learn something. I mean, that would be pretty hard. Thor followed me. Paula followed me. Thank you guys. If you guys know anybody else that's would like to learn about Medicare, Social Security, and retirement, share the link. Tell them I'm live. Tell them to come on over here. I can't say that it's fun, but it will be educational. I'm retiring from DOD agency at 65 upon full retirement from my job. If I switch from Aetna from my job, it switched from Aetna to MAPD. Dean, don't understand your question. If your ex-husband is alive and you declare disabled, can you collect of his earnings? If I'm disabled, I would collect Social Security disability only off my own earnings. It's based on how much I worked, how much I paid in, is how much I can draw out. So first I have to fight through the process to determine I am disabled, and then I might not get very much money. You can't draw disability off your spouse's work record. So only your own work record. Now, you might be able to claim your own Social Security disability. And at 62, when you and your spouse or your ex-spouse has to be 62, you could switch to a spousal retirement benefit in lieu of your disability benefit if it's higher. If I retire in December, should I be looking to sign up for Medicare in October? Yep, Greg, Gigi, you got it right. 3 months in advance. Liz, if your ex-husband is live. Okay, I got you, Liz. Carrie followed me. Thank you, Carrie. Whoops. Medca, if I take my retirement in January, I'll be 66. My ex-husband that I was married to for 12 years. As long as you're not married, you can draw Social Security off of his work record. So I recommend you go to Amazon, go to the search bar in Amazon, type in, I really need to do this. Type in Medicare space mama, M-A-M-A. The book will pop up. It is 360 pages. There is a whole chapter on Social Security spousal benefits and ex-spousal benefits, how to do it, some strategy not to do, what the reduction looks like, how it works if your spouse later passes away, and you have the ability to switch up to a widow benefit, another separate chapter. Everybody should get it. Give it to somebody you know. It will help you. Hardy, if you need the cheat sheet, click up here on my face with the pink circle in it, right up here. Click it a couple times. Then my face will pop up in the bottom third of the screen. Click on that. That's how you will see the free options and put in your email. Do I get to take half of his as more than mine? You can't get half of his unless you are at your full retirement age. You are 64, so the answer is no. You need to wait till your full retirement age. Medca, how you figure out what percentage of Social Security you can draw as a spouse is in my book. Go to Amazon, type in Medicare in the search bar, Medicare space mama, M-A-M-A. Read the chapter on Social Security spousal benefits. Married for 30 years, divorced for 1, he passed. If I'm not married until 60, can I draw off his at 62? Yeah, you could draw off his at 60. But if you draw at 60, you get 71.5%. If you draw at 62, you're going to get about 75%. Again, I don't have the exact amount memorized. It's on my free cheat sheet. But if you want the full amount, 100%, then you have to wait about 5 more years. You have to wait till your full retirement age, which is going to be closer to 67. You might say, I don't want to wait. I want it now. That's okay. Just understand that you're getting a permanently reduced amount. It's not going to go up later because you turned 66 or you turned 67. A lot of people think, I'll take it now, even though it's reduced, thinking erroneously that it will increase when they age up. No, it doesn't. So make sure you fully understand that. If I'm going to be 65 in May, work full-time, have medical from work, what's my best bet? If your company has 20 or more employees, do nothing. Call us when you retire. You don't have to sign up. You don't have to notify anyone. There's no papers to file. Do I know anything about Aetna MAPD? It's given to retirees over 65. So I think, Dean, what you're talking about is a group Medicare Advantage plan negotiated by your employer. Regular people can't buy that plan. So that is a private plan that your employer negotiated. Chuck, I'm 58, I get a pension, Social Security, wife never worked, wants Social Security at 62, can she? Your wife can draw Social Security at 62 if you are drawing Social Security. Yep. You can draw Social Security at 60 only if you are a widow. The only other people that draw early would be people on Social Security disability. None. I'm retired from the feds. Do I need to sign up for Medicare? Unless you're a postal retiree whose union voted to require Medicare starting this January 2025. All the other feds don't. You don't have to do anything. If you're happy where you are, just stay right there. I'm still working, turning 65 in January. I understand I need to apply to set up my Medicare. Well, if you're going to continue to work past 65, if your company has 20 or more employees, you don't have to take Medicare. You don't have to sign up for anything. But if you want to retire at 65, yes, ideally, Ideally, you get a plan for when you want to retire and start Medicare. Medicare starts the first day of the month, and you want to back that up about 3 months. So you sign up 3 months in advance because it takes a while to get all this stuff going. If you need help with Medicare, you can go to our website, the MedicareFamily.com. There's a little yellow button at the top of our page. That's where you book an appointment. Tell us when to call you. We'll call you from a 317 area code. We're in central Indiana, but we are licensed in all 50 states. Wherever you are, our help is free because we're paid as independent contractors by the insurance companies. We are not affiliated with the federal government. We are a small family business. I was just notified my Aetna is going from 46 to 96. Yeah, this is going to be a hard week because everybody's going to start getting their letters the next 2 weeks. And yeah. So the Medicare Part D drug plan cannot go up more than $50 over your 2025 plan. So as you can see, yours went up exactly $50. That's the most the government will allow them to go up because the government's still giving them a hefty subsidy. Yeah, to keep it that low. So if you're freaking that it's 96, it should be 150, but the government's subsidizing them. This is all the result of the Inflation Reduction Act because the last administration doesn't understand capitalism, free markets. I don't know. They did not understand. I don't have a degree in economics. I called it immediately. And I said, this will make drug plans insanely expensive. So you guys are just getting a little taste of it this year. $50 the most they can increase. KK Bell had a great call with Janelle. Janelle is fantastic. She is such a sweet, sweet person. Just joined the live. What about the Medicare drug? I got a lot of things to talk about the Medicare drug, so I don't know specifically what you want to talk about. The Part D, D for drugs, the deductible right now is $590 in 2025. That is going up to $615. Now, if you're taking cheap generics, a lot of plans don't charge you the deductible at all anyway, okay? But the $2,000 max that you can pay on your drugs, if they are covered by your drug plan, that is increasing to $2,100. So not bad. But your drugs to be limited to that maximum have to be covered by your drug company. You will see this year that more and more drug companies are slimming down the list of drugs that they cover. They're saying, oh yeah, we don't cover that. We don't cover that. We don't cover that. That's how they can save money. So when you start using your drug plan, be in for a shock. Is widow benefits and spousal benefits different? Yep. As a spouse, if I wanted to draw Social Security off my spouse, if he was the higher earner, if half of his Social Security was more than all of my own, the most I could draw is 50% of his amount. If he passes away, the most I can draw is 100% of his amount. Big difference, right? So that's why I told you guys to get my book. Go to Amazon, type in Medicare space Mama. You don't have to know the whole title. Medicare Mama's Guide to Medicare and Social Security Retirement. It is 360-page workbook. There is a QR code in the beginning of the book, so the book will not be outdated. So I've already updated it with the Medicare Part B deductible, Part D deductible. Those prices for 2026 are already here. When you get my book, click on the QR code and you will already be ahead of the game. Go to Amazon, type in Medicare Mama. You'll have the book in 3 days. If you guys are new here, please give me a follow. There's a heart right here with a plus. There's also a little bell if you want to know I go on live. My husband died when we were married for 23 years. If you have not remarried, Robin, you can get Social Security. You're almost at the age where you can get 100% of what he was drawing at his time of death. If he was drawing more than you, I recommend you get my book to read about widow benefits. There is some strategy involved. You might want to draw now, you might not. What is my income limits if I turn full retirement in October? We do not know yet. We will not know that until December. Currently, the earned income limit, if you draw Social Security and you're under your full retirement age, is $23,400. Gross annual income, prorated if you draw after January, $1,950 per month. That will go up for January. We won't know those numbers until late November. Anybody that has already downloaded my free Social Security and Medicare cheat sheet, I will update it with the numbers for 2026, and you will get it first 2 weeks of December. You don't have to ask for it. I update it. Anybody that's ever downloaded it gets a new one. Why is a supplement better than an Advantage plan? If you can afford a supplement, and that's the whole ball game, right? Why is flying first class better? The seats are way bigger. The service is amazing. You get on first, there's more bins. You know why? Do you want to pay for it? Sometimes I do. Sometimes I don't. I just flew out to Boise to do a training for Idaho agents. I flew first class there. I flew economy back. I don't know what my thought process was, but it's like, how do you want to spend your money? A supplement is better. It's got a bigger seat. It's got better service. A Medicare supplement allows you to go to any doctor, any hospital in the country. Right now, it's in the news a lot that Johns Hopkins, one of the top 5 hospitals in the country, consistently rated one of the top 5, is no longer going to accept United Healthcare, the largest insurance company in the world. So there's tens of thousands of people that can't go to Johns Hopkins, that live right there in DC and Maryland and Virginia. It's right here, one of the best hospitals in the world, and they can't go there unless they want to pay out of pocket. With the Medicare supplement, you can go to any hospital, go to any doctor in the country. You pay more for a Medicare supplement. With a Medicare supplement, once you buy a plan, so let's say this is my Medicare supplement plan G. These are my benefits. I read it all. I understand it. It can never change. Medicare Advantage, if this was my Medicare Advantage plan for 2025, it will change for 2026. It will change for 2027. It will change every year. The copays, the deductibles, the premium typically doesn't, but it can. Yeah, it changes every year. Medicare supplement will never change. There is more red tape getting care with a Medicare Advantage plan. Typically, you have to ask your insurance company to approve getting a surgery. Not with Medicare supplement. If your doctor says you need a new hip, go book it. Do it tomorrow. But again, I don't want to be disrespectful for people that cannot comfortably afford a Medicare supplement. Like I said, a lot of people cannot comfortably afford to fly first class. You buy what fits your budget. Spread love. If you can't find my book, you're probably typing in mama wrong. That's what I found. It's Medicare. In the search bar for Amazon, type in Medicare, leave a space, type in M-A-M-A. People that can't find it, they're typing in M-O-M-M-A, and then they don't find it. Lady Mole. I have United Healthcare Plan G. Are you saying Johns Hopkins is not taking that? Yep. You can, oh, no, G, you can go anywhere. Lady Mole. I said a Medicare supplement plan can go to any hospital, any doctor. Medicare Advantage with United Healthcare can't go to Johns Hopkins. Oh, you did, Mama? It didn't pop up? Well, 8,000 people have bought the book. So I know it's there. I don't know what you're doing, Spread Love. It's there. Are you in Amazon? I have Plan C and UHC. Is that changing? If you have a Medicare supplement plan, it will not change. The premium will go up. Spread love. I don't know. You're doing something wrong here. Okay, so there should be a link. I'm going to show you how to get to the link here. My son set this up. Click on my face up here with the pink circle. This is how you get to my free Social Security and Medicare cheat sheet. My workshop, my private Facebook group, a whole bunch of stuff is here. But this is also the link to Amazon. So click on my face with the pink circle a couple times until it makes my face pop up down here. Then click on my face down there. Then you can get in the back door, Spread Love. That'll give you to the Amazon link. It should, at least. D, what's the difference between Medicare supplement and private insurance? Medicare supplement is private insurance. Carrie, yes. Medicare Part C is Medicare Advantage. You guys are catching on here. A lot of names mean the same thing. Social Security widow benefits are survivor benefits. Medigap plans are Medicare supplement plans. A lot of different names. I know. It doesn't make you guys happy. I'm getting ready to retire. I choose Kaiser Senior Advantage. Okay. I'll be 66 on April. Is it convenient to request Social Security events end of December? Yeah. But you'd want to do it the first week of January. You got Plan G, Barb Stribley. Yeah. Prepare for a double-digit increase this year, though. It's better. It is better, but it is more expensive. Sylvia, Yanez Evans W. I started getting widow benefits. Can I keep working right now? Only if you work part-time. If you're under your full retirement age, part-time. I don't know when you started getting benefits. If you got them in the middle of the year, you can make $1,950 gross per month. If you exceed that monthly, they will start reducing your Social Security. Natasha, does spousal support count for IRMA calculations? Yes. If you work part-time, can you still file for Medicare? Yeah, you can file for Medicare if you work full-time. Social Security is the one that limits your income. So I don't think I'm getting quite at your question. Does your book show all the prices and coverages of each plan? Kim, yes, I explain how they price plans, what the average price of plans is, how that works. It's very different from state to state. It can be different within your state by zip code, but I explain all that. It's a mouthful. That's why I had to write the whole book. Can I switch Plan G? Calvera. You can switch your Medicare Supplement Plan G to another Plan G, to a Plan N, to any other Medicare Supplement plan at any time of year, if you're healthy enough to answer those health questions. So book an appointment. Let's see. As long as you don't have anything major, the big stuff, pacemaker, you walk with the cane, you've had cancer recently, you have Parkinson's, HIV, COPD, emphysema, the big stuff, MS, then you can't switch unless your state allows you to switch in a period around your birthday. So if you don't have any of that big stuff, book a free appointment with our team, themedicarefamily.com. When you go to our website, you'll see me, you'll see my parents, my son. That's why we call ourselves the Medicare Family, 3 generations. You will see a little yellow button. That's where you book your own appointment. We're licensed wherever you are. We'll explain it to you, what's going on with your state laws, and help you. And yes, I know it's very confusing. I work for a big company. Should I get Medicare getting ready to retire? If you're retiring, are you saying that you need Medicare, or they have a retiree Medicare program for you? Typically, when you retire, you have to go get your own Medicare. So I don't know if you're getting health benefits through them. If you're not, then you definitely want Medicare, and you want to sign up ideally 3 months before you want it to start. And if you want us to hold your hand and walk you through the process because you're overwhelmed, I get that too. Go to our website, book an appointment. We're very patient. We've helped tens of thousands of people, and we'll walk you through the process. Go to our website, themedicarefamily.com, a little yellow button at the top of the page, book an appointment, no obligation, no cost. Is the $600 increase per month? D. Don't know what your question is. Which Medicare plan is best to have? I also have lifetime medical with my job. If you have lifetime medical with your job and it's excellent, I don't know why you need Medicare. When you say it's excellent, I mean, if it's excellent, if your lifetime medical is good, you don't need anything else. You might supplement it with a cancer plan, which I always recommend, or a hospital indemnity plan to help you pay your copays. But you really need to dig down and look at your retirement plan. It might be great. You might not need anything else. I've seen some great ones. It's rarer now. JJ, thank you for joining me. If I want to get supplemental plan G, do I have to get an agent or call directly to insurance? It's the same thing. If you call them or work with us, an agent, same difference. But if you work with us and then next year you want to switch to a new company, you just call us again. You don't have to call a different company. We can help you with your claims. We can help you with all your problems. You pay the same money if you call them directly or you call us. So it's up to you. If you want our help, go to themedicarefamily.com. We will help you. I have 2 of the big ones, health issues. So that means I have to keep the same plan. Yeah, Carol, if you have the big stuff, then you're not going to be able to switch unless you have a state with the birthday rule. You can Google that. I turned 65 in October, retiring next April. When should I call you? Dean, 3 months before April. So what is that? January. 3 months. Medicare will start the first day of the month. So make a note for January 2026. What if I've had 3 seizures but not any longer because of meds? Julie, that's more of a gray area if you don't have epilepsy. If you do have epilepsy, then yeah, you're probably not going to be able to change. But if you had a fever seizure, I don't know what other thing could call the seizures, but I would say likely that you're not going to be able to switch. How far back do they look if I had cancer? Typically, they're going back 5 years now. Some of them used to go back 2 or 3 years, but now they're more and more going back 5 years. 65, you have to have Medicare. No. Why do some primary doctors only accept Medicare Advantage? Because they get paid more money. They're on special contracts where they can share in the profits with the Medicare Advantage company at the end of the year if they can save the Medicare Advantage company money. Do I want that doctor? I do not. I do not want a doctor that's reluctant to order my MRI or order my CAT scan I don't want a doctor that's primary focus is to save the insurance company money and thereby profit himself. So yeah, the answer is always money. If you guys learned something tonight, even if it's ugly, like that little tidbit, please consider giving me a follow. There's a heart with a plus right here. Also, I need to get 100 likes because that tells them that we like to talk about educational things. Please tap the screen. It makes little hearts go. It doesn't cost you anything. Little hearts, as many as you can. I appreciate it. Should I allow AARP Medigap to pay my Medicare deductible through my checking account? I like it. I haven't seen any negatives about it. Doesn't hurt. I'm not against it. Tiffany loves my hat. Thank you very much. I really don't like this hat. I never wear this hat. It's plastic. It's got a bad feel to it. But since you guys are complimenting, maybe I will take it on a little spin. Give it, because this is one of my, I don't like this one. Leandro, I got a pension, Social Security, 457, but will not retire till 67 and a half. When do I call you? We do not help you with financial planning, with the withdrawals of your tax deferred accounts. We do not help you with Social Security. I give advice online, but we do not do consultations for that. When you need Medicare, that's when we help you. And you will need Medicare. You want to sign up for it 3 months before you want it to begin. So you're going to back that up from when you hit your 67th birthday. Okay, is it beneficial to have my Advantage plan have a home visit? It just drives some people crazy and other people like it. So you don't sound like you're offended at the concept of it. And yes, some of them will give you like a $25 gift card or a coffee card or whatever. So yeah, if you're down for that, I've done a million things just to get like a gift card. If you don't like it, you felt it was a waste of your time, invasive, then just don't do it again. Medicare Advantage plan is, so Medicare Advantage is Plan G. No, Julie, Medicare Advantage is PPO or HMO. A Medicare Supplement, Plan G, is a private insurance plan. Just sign up for Plan G and I let them take it out of my checking account. Barb, I'm okay with that. We're okay. Will the Medicare Supplement increase to $600 be charged each month? I don't know your situation. My brother never worked due to medical conditions. Turning 65, can he apply for Medicare A? If he's never worked and he's never paid in, he cannot get Medicare Part A for free. He can pay for it. It will cost him about $530 a month and then have a separate deductible of about $1,700 per occurrence, but he cannot get it for free. Now, if he gets married and he's married for only 1 year, he could draw it for free off of his wife's work record. Not on any medications. Do I still need Part D? Yes, you do. Do I need house insurance? I've never had a wildfire. I've never had a flood. Never had a lightning strike. Why do I need house insurance? For the what if, for the right around the corner tornado that might take my house out tomorrow. That's what you need to think about your health insurance. Your health insurance is more important than your house insurance. How much is Part B next year? Mary Carmen, it is currently $185. That's what the average person pays. It's going up 11% in January to $206.50. Now I remember when it was $104, and it's making me feel old that it's going to be $206. Yeah, that's the least of my problems. What is the best Advantage plan? Lady Diana, there is no best plan. We need to know your drugs, the dosages. Are they caplets? Are they tablets? I mean, we have to dig into the specifics of your medications. Your doctors, the hospital that you prefer to go to. Where do you live? Medicare Advantage plans are based on your zip code. Do you spend a lot of time outside of your zip code? So there's lots and lots of personal things we need to talk to you about to give you a personal recommendation. Any insurance agent that says, oh, go with Blue Cross, Aetna's the best, Cigna, that's a lazy person, because there is no best plan. There never has been. There never will be. It's a personal decision based on, like I said, all those personal questions we need to ask you. If you're getting ready to go on Medicare and you want us to help you with it, it's free. Go to the MedicareFamily.com. That's our website. The Medicare Family. We're a third generation family business. There is a yellow button at the top of the page. Click on that. Book an appointment. It is free. We call you on the phone from a 317 area code. We're licensed in all 50 states. Our help is free because we're paid by the insurance company. So you do not have to pay us. If you learned something, please give me a follow, subscribe. There's a little heart right here with the plus. I would greatly appreciate it. You can't get G until your retirement age. Jeff, in most states, not all, in most states, you cannot until you're 65. You can in Florida. You can in New York. But in most states, no. I'm a widow. Will I collect 100% of a husband's benefits at age 60? No, you will get 71.5% at 60. I wrote the book especially to help widows, stay-at-home moms, spouses with Social Security. It will tell you how much you get at 60, 71.5%, how much you get at your full retirement age, and what that is based on the year you were born. It would be 100%. The strategy of when to draw, when to delay one, to take the other benefit. It's all in my book. Go to Amazon. In the search bar for Amazon, type in Medicare space Mama, M-A-M-A. You will have the book in 3 days. It's $24.99. It will save you much more than that in money. Vance, that's me. I think I asked before, but I get disability. Can I get Social Security too? No. I have full insurance since I retired and plan on keeping it. Okay, then you don't need anything else. I work for a big company. I'll be 67. I have medical insurance and will continue to work. You don't need to do anything, notify anybody. There are no paperwork to sign. Whenever you do want to retire, book an appointment with our team. Then we'll help you with the paperwork on the back end. Nothing to do now. I became a widow at 60 and took Social Security. Will it never change? Correct. It will be level for the rest of your life unless we get a cost of living adjustment, which we do most years. We will get one this year. We don't know exactly what it will be until the inflation numbers for September are over. They're thinking it's going to be about the same as this year, 2.5%, maybe as high as 2.7%. Why do we have to pay for Medicare A and B if it's been taken out of our work check for over 40 years? Medicare Part A was taken out of your check via payroll FICA. Medicare Part B you pay for. It was not taken out. Medicare Part A was taken out of your payroll. Medicare Part A is paid up. It is free. I became a widow at 60. Lady Diana, thank you very much. I need to restate what I said. Outdoor adventures. Darn it. Where's the rest of your question? If I'm going to be 65 and I'm still working, don't need to sign up for Part. No, you don't have to do anything. What was the big drug insurance company that will no longer be offering? You talked about Cigna. Cigna will not be offering their Part D drug plan in the state of Florida and Hawaii, which is crazy. What is the name of my book? Just the book's name is long. The book's name is Medicare Mama's Guide to Medicare and Social Security Retirement. You don't have to type that in. Just go to your Amazon search bar like you were going to buy new wool socks. The Amazon search bar, type in the space, type in Mama, M-A-M-A. It will. Emma says that I'm breaking up. Does anybody else think that I'm breaking up? Great connection, and I'm very proud of my connection tonight. Is this Emma's thing, or is everybody saying I'm breaking up? Can you retire at 60? No, you can't retire till 62. Bocat. My husband will be 62 in October. He's still working. Can he apply for Social Security at 65? Yeah, but make sure he's not working full-time at 65. Martha, thank you for joining me. I have VA disability. I also have Social Security disability. I have Medicare Part A. Okay, Martha, what is your question? Do you need B? You do not need B if you want to get all your care at the VA. The VA doesn't require A or B. How soon is it to start planning and looking for different plans? Carrie, if you have a Medicare supplement plan and you want to try to find another Medicare supplement plan, you can do that at any time of year. Do it now while you're healthy. Call us, book a free appointment. Go to the MedicareFamily.com. If you want to shop Medicare Advantage plans, you can't do that till October the 1st. They're not public until October the 1st. When do I have to sign up for Medicare? I'm 61. Tammy, 3 months before you turn 65. Yeah, Lady Diana, I don't know if I'm pronouncing your name right. Diania. I'm trying to warn people that because you got a big rate increase for your Medicare supplement this year. And you think, whoo, that was bad. Well, it's going to be again. 2026 is going to be again. It's going to be similar. So if you're going to struggle to pay for that Medicare supplement plan G, even though it's better insurance, during the fall, October 15th through December 7th, you might want to go to Medicare Advantage. Because it's affordable, because your budget. Now, if you do go to Medicare Advantage for the first time, so it's just Diana. Okay. Diana, good, thank you. If you do decide to take the leap and you switch from a Medicare supplement plan G to Medicare Advantage, and it's the first time you've ever done it, they give you 12 months free look. Anytime in there, you could say, I don't like this, and go back to your Medicare supplement. They have to take you back. That is called Medicare Advantage Trial Rights. I explain it in more detail. It does sound too good to be true in my book, Medicare Mama's Guide to Medicare and Social Security Retirement. Go to Amazon, type in Medicare space mama. You will see it. Money in the bank for my daughter. Money in the bank for my daughter. What does that mean? If you go back to Part A, can you just go back to B later? Depends on your situation. You might end up with a late penalty. Thank you, Brenny. I appreciate you. Yeah, Carrie, if you want to shop your Medicare supplement, do it now. Do it while you're healthy, because you never know what's around the corner. Go to our website. It's automated. Just book your own appointment. Don't call us. Go to our website, themedicarefamily.com. Click on the yellow button, book an appointment. We will call you, talk to you, and see what we can do about your health in your state, what's available. I'm on disability. I have fibromyalgia, and I also have 5% Social Security when I hit 65. I don't know what you're saying, 5% Social Security at 65. If you go back to Part A, you can go back to B later. It depends on your situation. Can you get widow benefits? Retire at 60 as long as you're not working full-time? Yes, you can. You will take a permanently reduced amount. It would be 71.5%. It would only increase infinitesimally if we get a cost of living increase each year. So make sure you understand the permanent reduction and decide if it's worth it or not. I'm confused. Are you saying Medicare Advantage is the way to go? No, I'm saying there's no way to go, Barb. Everybody's situation is different. Everybody's health, the drugs you take. Are you getting divorced? Are you getting married? Everybody's situation is different. For some people, Medicare Advantage will be the best choice. For some people, Medicare Supplement Plan G, Plan N, high deductible G. Everybody's different. We look at every person as an individual. We're going to not give you a cookie cutter. Yes, you can collect Social Security. If you withdraw from a 401k during the tax year, can it count towards IRMA increases? IRMA doesn't look back for 2 years. So if I take money out of my 401k, it's taxable this year as far as the state and the feds go. Medicare IRMA will look at it 2 years in the future. It's my taxable income. So yes, it will trigger. It has a likelihood to trigger Medicare IRMA. Does Medicare supplement vary by price, by health? So Diana, the typical answer is no. There are certain times where they can't ask you about that. But like I moved my dad from a Medicare Advantage plan to a Medicare Supplement Plan G at 88. because he had type 2 diabetes, he had to pay more, about $50 more per month. So yes, depending on your situation, you could have to pay a little bit more. Generally, they just don't take you. Like you're either sick or you're healthy. If you're healthy, they take you. If you're sick, they don't. Can you go off Medicare Advantage and go back on employer insurance? If your employer will allow you, most do not. They consider that a one-way door. Once you leave your employer group health plan, they're not required by law to ever allow you back. They could be nice, but they don't have to. If I decide to collect widow benefits at 65, what percentage would I get? At 65, you would get 91.86%. If you guys want my free Social Security and Medicare cheat sheet, it will tell you the percentages. Bottom right corner, click on my face with the pink circle up here. Click a couple times until it makes my face pop up in the bottom half. Click on my face there. Put in your email. You'll get my cheat sheet right now. If you don't see it, look in your spam folder. If you guys learned something, there's a little heart right here with a plus. Will you please give me a follow? I'd appreciate it. Your same Plan G has a high deductible. I thought I had a zero deductible. I said there is a Plan G. There is a Plan G high deductible, which is a separate plan. You're also wrong. Plan G itself does have a deductible. No Plan G with a zero deductible. The deductible on a Medicare supplement Plan G this year is $257. That deductible will increase. It's $288 in January. FICO, thank you so much. You are precious to me. I don't really know what those gifts mean, but I like them. I like them going up on the screen. Can I draw off my wife? Buzz, if she was a higher earner, if she's drawing her own Social Security, if half of hers is more than all of yours, if she is at least 62 and you are at least 62, yes, you can draw Social Security off of your wife. Sarah Sharon, when I turn 60, can I draw for my husband's full Social Security? I'm disabled. Nope. You will need to be 67. I'm on disability. I'm 57. I was married for 14 years. I never remarried, but he did. Am I entitled to his Social Security? You're married long enough. If he is 62, yes, you can draw. Never work. Can I apply for Medicare Part B while on Medicaid? Absolutely, Chloe. There's about 10 million people that have both Medicare and Medicaid. So after you apply for Medicare, book an appointment with our team, themedicarefamily.com. We can explain to you if there's a Medicare Advantage plan that wraps around your Medicare and Medicaid, how that works, if it's available. It's no additional cost and it can give you some additional benefits. My ex keeps taking loans on his pension. When he passes, am I responsible for them? No. How can I purchase your book? Go to Amazon. In the Amazon search bar, where you would normally type in, I need wool socks, type in Medicare, leave a space, type mama, M-A-M-A. It will pop up. You'll have the book in 3 days. $24.99. If I draw from my 401k at 60, will it affect IRMA when I turn 65? Nope. Medicare IRMA looks back 2 years. What's the difference from Medicare Advantage and Medicare Supplement? I have about an 8-hour class on that. I don't want Medicare. I'm on disability. Can I cancel Medicare? Yeah, you can file. Go to Google and search in terminate Medicare. When you got your Medicare card in the mail, it would tell you how to decline it. How do I apply to receive my ex's Social Security? Go to the Social Security office. You need an appointment. Take a copy, a certified copy, or your original marriage license, your divorce decree. They can tell you. Rebecca, I just purchased your book and the workbook. Fantastic. Now you got to go to work. I kind of feel bad for you guys because it is a lot of work. It's a lot. You don't have to read the whole thing. So you're not going to this is not a novel. You're not going to sit down and read a 360-page book. Different chapters will apply to you at different times in your retirement. So required minimum distributions don't start till 73, so you're not going to have to read the whole book. You don't have to be daunted like that. Control of your own medical in a nutshell. At 67, can my husband collect from my retirement even if he is not a citizen? Has he been here for 5 years? If my ex is drawing disability, can I also draw on his? Yes, if you are at least 62. When you retire, do you have up to 8 months to sign up for Medicare. It depends on when you retire, at what age, what reason you are retiring, what different timelines are being triggered. So in general, if you're over 65, you don't want COBRA because COBRA only pays after Medicare. So you need Medicare right away. So you don't want to wait 63 days or 6 months or 8 months, even if you could, because you need coverage. Just received my Medicare card, turning 65 in December. Is it time for an appointment? Yep. If you have your card, Sandy, you are ready to go because we need to know the date A and B started, and we need to know your Medicare, that 11-digit letters and numbers. With that, we can help you enroll in your plans. And we can make it so it starts January the 1st because I'm not January the 1st, December the 1st. It starts the first day of the month that you turn 65. So go to our website, themedicarefamily.com. You'll see a yellow button at the top of the page. Click it. Tell us when to call you. Have your card ready. We'll help you. What do you think of Medigap versus Medicare? So if you can afford a Medicare supplement plan, a Medigap plan, same thing. Buy it. Start Medicare there. Start at the top. If you can afford it. If you cannot afford it, I respect that. But I think you should buy the best health insurance you can afford and then just know it's going up. Whether you use it or not, it's going up double digits. And that there will come a time in the future where you're like, I cannot afford this anymore. And we'll be here to help you with that choice too. So buy the best insurance you can afford. I just ordered your book, Need Info on Widow's Benefits. There's a whole chapter on widow benefits. I go into that with specificity because they are complicated. Just skip to that chapter. I'm 62. I have health insurance. I can't retire because I don't have insurance. I don't know the rest of your question here. How do you get half of my ex-husband's Social Security if we are legally separated for 2 years but not divorced? Only way you can get half, Julie, is he has to be drawing his own Social Security. You cannot draw as a spouse, you're married, until he draws his. So if he doesn't draw, you cannot draw. Then if you want to get half, you have to wait until you reach your full retirement age, which is going to be closer to 67. So if you want to get less, you could draw as early as 62, but you would only get about 30% permanently locked in. So make sure you understand that. If you learned something, there's a little heart right here with the plus. Please give me a follow. I would appreciate it right up here. There's also a little bell over here if you want to be notified when I go live. How long have I been talking? 1 hour and 3 minutes. Woo! I'm getting tired. Guys. I'm going to keep going. My husband's not home yet. He went to play some tennis. I'll talk till he comes home. I'm 66, still working. I'll be 67 in March. I have signed up for Medicare back before I turn 65. What? You signed up for Medicare Part B? Why? I don't know why you did that, but you need to terminate it if your company has 20 or more employees because you are throwing away next year $206.50 a month. A lot of people do what you did. If you don't need it, can you just get Part D for meds? Yeah. When do I apply if I want to collect Social Security at 62? You can apply 3 months in advance. What is Medigap cost based on? D, it's based on your gender. Men pay more. Your age. Most states, older people pay more. And your zip code. Very, very, very dependent on your zip code. For example, if I'm turning 65 and I'm in Ohio, I'm turning 65 as a female, I could get a Plan G for like $100. If I'm anywhere in the state of New York, it's going to cost over $300 for that same Plan G with that same insurance company. Zip code is very important. If you need an appointment, you want to talk to us, you want us to run rates based on your zip code, go to our website, themedicarefamily.com. There's a little yellow button at the top. Click on it. We will call you when you tell us to. We call from a 317 area code, so be waiting for that. We are not spammers. We never, ever call anybody unless they book a specific appointment. Tanya, my husband turned 65 in January, will automatically be enrolled in Medicare. He's only automatically enrolled if he's drawing Social Security 4 months before he turns 65. So if he's like not drawing Social Security at all, then it's not automatic. He needs to go and sign up, and he wants to do that 3 months in advance. So in October. which is weirdly only a couple weeks away. Another question, can I get a Medigap at age 62? In most states, the answer is no, but it is yes if you're on disability. In Florida, it's outrageously expensive. In New York, there's only a few states, so in general, no, not till 65. I'll be 65 December 20th, working and using employer insurance. Is it time for me to apply for Medicare? If you're turning 65 December 20th, are you going to stay working? I mean, if you can stay working and be 65 and stay on that insurance, and you don't have to do anything. So my question is, do you want to retire and go on Medicare? Or does your company have 20 or less employees, in which case then you have to sign up for Medicare? You want to sign up the first week of October so that it starts December the 1st. I'm 66, still working, will be 67 in March. I have signed up for Medicare back before I turned 65. Yeah, so you're the one that I don't know why you did that. Does your book cover dropping Medicare for private insurance? Does your book cover? Yeah. Do you have to keep applying for Medicare plan every year? If you have a Medicare supplement plan, it never changes. As long as you pay the premium, they can't change it. You can keep it forever. If you have a drug plan, they can just cancel it. So a lot of them are sending people letters that you'll get in September that saying, hey, we're not offering your drug plan. Go find a new one. For the other 50 million people, they'll get a letter that's saying, this is what your drug plan looks like for next year. And you might say, ooh, I don't like that. Or you might say, that's fine. If you say it's fine, you don't have to do anything. They'll automatically enroll you in their plan for 2026. If you don't like it, you'll go to Medicare.gov starting October 15th and pick out a new drug plan. Medicare Advantage plans change every year. Medicare supplement plans do not change. I'll be turning 65 in June. Vicki, but I pay for my own insurance that I can't afford. Do I have to sign up? You might want to go to my workbook, go to page 88 and do the workbook section where you'll put in how much you pay to stay on your plan, what the deductible is, what the copays are, all of that. And I will show you what Medicare costs. You might find Medicare is cheaper. It's better. You can continue working and drop off their health insurance if you get a better deal. But if you want to stay working, you don't have to have Medicare as long as your company has 20 or more employees. You do not have to start Medicare. I'm only 57. I'm on disability. You said I could get part of my ex's Social Security. Do I have to wait until I'm 62? He has to be 62. You don't. I will be 65 in July. I keep working and keep my employer's health insurance. Okay. Janet, for Medicare Part A, only 3 months before. Yeah. Yep. Vicky's going to buy my book. I appreciate you, Vicky. Does Plan N need referrals? No, thank God. I retire at 65. I'll be on my wife's insurance. Do I need Plan A and B? Nope, you don't need anything. Applied for Social Security retirement, plan to continue to work and apply for Part B. Is that okay? I don't know how old you are. I don't know what's going on. D, TRICARE forces you to sign up for Medicare B to continue to be eligible. True. Correct. If you want your TRICARE to turn into TRICARE for life at 65, you must sign up for A and B. Why wouldn't I sign up for Part A only, Janet? Because if you have a health savings account, you cannot continue to contribute to it if you have Medicare Part A. Part A generally doesn't benefit you, so some people just don't even want to mess with it. But yeah, you can do it if you want, as long as you don't have a health savings account. If you want to know what the best drug plan is, you have to wait until October 15th. Go to Medicare.gov, put in all your drugs. That will tell you. Carol, I'm moving from Florida to California. I have supplement plan G through Cigna. Can I just take that? Yeah, you can just call Cigna, give them your change of address. They will update your rates for your new zip code in California. Florida has high rates, though, higher rates than California. So if you're healthy, you might want to apply for a new plan at a lower rate than what you're locking in. I take early retirement at 62. Does Medicare enrollment automatically at 65? Yep. Yes, it does. Anybody that's drawing Social Security, any type of Social Security benefit, if you're getting it at least 4 months before you turn 65, they automatically enroll you in Medicare A and B. They send you the red, white, and blue card. So it saves you some time. If you don't want it because you're still working, because you're on your husband's work insurance, the letter will tell you how to decline it. You're going to send it back, take a picture of it, But you don't have to keep it. If you keep it, they'll be charging you for Medicare Part B, which next year is going up from $185 a month. In January, it goes up to $206.50. AARP is up 18%. Jay, you said it, not me, and I will tell you that is a low one. That's low. Janet, lots of learning required with Medicare. Yeah, lots. There's lots, and they're always changing it. So you can't rest on your laurels like, oh, I got this stuff. It is a lot to manage. If you guys learned something, there's a little heart up here, a heart with a plus. Please give me a follow. I try to get 100 followers when I talk for an hour. Appreciate you. Can I elect to get Part D anytime or only during the fall? Depends on when you retire. There's different things that are happening that can give you a special time to enroll, but in general, you're only getting it when you first go on to Medicare. Or if you have already had it and you want to change, you can only change it in the fall, October 15th through December 7th. Why does zip code make a difference? Private insurance is based on your zip code, just like Walmart. Walmart prices are based on your zip code. I figured that out by going to a really, really poor Walmart. Everything was cheaper. And then going out to Colorado to a rich Walmart, I was like, oh my God, that's dynamic pricing. Medicare supplements do the same. I turned 62 this past August. I'm still working, but want to start drawing Social Security. When should I apply? 3 months. You're already 62. So 3 or 4 months before you want it to start. I'm 57. Should I be concerned about the Trump administration eliminating Medicare and Social Security? I'm not. At retirement age, applied for Social Security, will I continue to work? Applied for B. I would not have B and have your work insurance with 20 or more employees. You're likely to be wasting $206.50 a month. How much is Medicare going up in January? It's going up 11%. I just purchased your Medicare Mama book. My question is it updated for 2026? So Rising Sun Dawn. The very beginning of my book, you will find this QR code. This has the updates. So this will tell you Medicare Part D is currently $185. It's going up to $206.50. The Part B deductible, currently $257. It's going up to $288. On and on and on. That's all right here. Any major updates right there in that QR code, so the book will not go out of date. That's how I found out about Walmart. What happens if you make too much money after drawing Social Security? They will reduce your Social Security, or they will stop your Social Security, and you will be in a debit situation with them. And when you pay them back, then your Social Security will start again. Do I need to enroll, or am I already going to in July of 26 since I'm 65? You have to enroll. Do I need any documents to take with me to sign up for Social Security? If you're a naturalized citizen, if you changed your name when you got married, most people, they only need, their checking account to have it drafted. But if you're drawing off a spouse, you'll need your original marriage certificate or a certified copy. If you're drawing off an ex-spouse, you'll need your marriage certificate and your divorce decree. Do I need any documents? That's it. Am I in disability? I was awarded ex-partial 401k. How does this work for disability? That has no bearing at all on your disability. So just ignore it. It will not hurt you. If you're new here, I talk about Medicare, hence the name Medicare Mama. I spent 30 years training insurance agents on Medicare. It's going to be a hard week for me because they made some amazing changes last week. So I will be doing a lot of training for insurance agents. I train insurance agents all over the country. Claudia, I'm 57. Should I be concerned? Nope, I wouldn't be concerned. There's stuff to be concerned about, but you just can't spend your whole day worrying about everything, right? Married 11 years, divorced, remarried 11 years, divorced. First husband passed away at 67. Can I draw on first? Yes. K, because you're currently not married. Thank you, Mary Carmen. I appreciate you. Iris, I'm on disability. Been separated from my husband for a long time. Can I collect from his? You can only draw Social Security off of a husband, off of a current spouse, if he's drawing his own Social Security. So a lot of times the men want to work a couple more years. If he's not drawing his, you can't draw a spousal benefit off of his work record. When can you draw your husband's Social Security? So when you're at least 62 and he is drawing his own Social Security. Again, if you're drawing early, 62 would be early, make sure you understand your earned income limit so you do not exceed that. This is overwhelming. I know. I know. I would say the one word I've heard the most in my 30-year career as an insurance agent is I am overwhelmed. Second to that would be I'm frustrated. Third to that would be I feel very vulnerable. And almost every client says the same thing. And everybody feels like it's just them. Like they're the person that just didn't manage to figure this stuff out. And everybody says the same thing. So that's why I said, don't feel bad. Everybody's starting. We're all starting at the beginning. Stay-at-home mom. Husband is 67 and drawing. I'm 62. Can I draw on his? Yep. Nana Mary, you can draw about 30%. If you draw now, that's permanent. If he dies before you, that will not impact you as a widow. You could still draw 100% as a widow. So if you want to draw more than 30%, you need to get my Social Security and Medicare cheat sheet. It'll tell you the percentage of 50. 50 is the maximum percent of his that you can draw while he's alive. 100% is the maximum you could draw if he passes away before you. Get my Social Security and Medicare cheat sheet. It's the bottom right-hand corner. You'll see your age. If you draw at 62, you get 65%. That is 65% of 50%. I said 50 is the maximum you can draw from a living spouse. So if you do that math, that nets out to be about 31% of his amount. You can get my Social Security and Medicare cheat sheet. It is free. Click up here where you see my face with a pink circle. Click a couple times. Click on my face when it pops up in the bottom third of the screen. Then you'll put in your email. This will go immediately to your email. If you don't see it, check your spam. I update this every December, so you'll automatically get the new one with the new numbers for next year. Thank you, Mitchie Mathers. I appreciate you guys too. If you learned something, tell your friends, tell your neighbors, tell people at church. People do not know this stuff. How does an awarded 401k from X affect disability? Not at all. If I'm on disability and I win the lottery and I win $1 million, does not impact my disability. Does not impact my Social Security. It's passive income. Now, if I'm on Social Security retirement and I take $200,000 out of my 401k, doesn't impact my Social Security, does impact my Medicare. What is the benefit of having the original Medicare insurance? The benefit is that you can then buy a Medicare supplement plan and go to any doctor, any hospital in the country. Sunshine. I can't afford this, only make 1,000, need housing. How can I do this? Sunshine, you will apply for the Medicare Savings Program. They will help pay for your Medicare Part B. You can apply at any time. 67, about to go on Part B. Any good advice? We've helped tens of thousands of people with this. So yeah, I've got a lot of good advice, but I need to know more than your age. I need to know the drugs you take, your health, your longevity, your genes. What are you expecting to happen? Are you getting married? Are you getting divorced? Are you moving? Are you retiring to another state near your grandkids? What is happening? We have a lot of questions to ask you to give you advice to help you with your coverages. If you want a free appointment, go to the MedicareFamily.com. There's a little yellow button on the top of our page, book a free appointment. We call you from 317 area code, and we can give you a lot of advice. It is all free. We're licensed in all 50 states. What happens when you move to a different state? You need to change your insurance. I'll be 62 in February. My state wants to go part-time. It says it can't work more than 40. If me at 62 start drawing, if me at 62 start drawing, my wife will get a check. If your wife is at least 62, if she's not working full-time, she can also apply and get a check. As a corollary to the person that says, what happens when I move to a different state? Medicare insurance, we have a lot of things we have to do. Social Security, you get the same amount. It doesn't go up or down based on your new address. Just keep your address updated with the Social Security Administration in your SSA portal. What's the best plan to have, Grandpa Mark? There's no best plan. If you can afford a Medicare Supplement Plan G, get it. That's what I'll buy at 65. What company will depend on your zip code, what state you're in. I'm turning 65 in April. I have no idea what I'm supposed to do about Medicare. So Terry, we've helped tens of thousands of people like you. My parents have started doing this 45 years ago. I've done it for 30 years. So yes, we can help you. We can hold your hand, walk you through the whole process. So you're starting in April. Medicare starts the first day of the month that you turn 65. So we'll say April 1st. I'm going to back that up 3 months. So January, February, March. So the first week of January, You will go to socialsecurity.gov. You will sign up for Medicare A and B. You do not have to sign up for Social Security. If you are already drawing Social Security, you don't have to sign up. They will send you your red, white, and blue card. But if you're not drawing Social Security, sign up for Medicare A and B the first week of January. It will start April the 1st. Or you can just call our office, themedicarefamily.com. Just go to our website, book an appointment, themedicarefamily.com. There's a little yellow button on the top of our website. Click there, book an appointment. You can only book it a week in advance. So make yourself a note, and then we'll walk you through the process. We will help you. Our help is free. We're paid by the insurance companies as independent contractors. All these people are calling me. You'll be 65 in February. Don't trust them. Anybody that calls you is breaking the law. It is illegal to call you. We don't call anybody that has not booked a specific appointment with us. If somebody cold calls you, hang up on them. What's the most I can make in retirement to avoid IRMA? The most you can make of your total source of income, you'd be safe staying under $106,000 as an individual and your adjusted gross income. I get a city pension. Does it affect my Social Security taxes? Yep. Does Medicare pay for hospice facility? That's kind of a tricky question. Medicare Part A will cover hospice. Hospice is free in your home. If you go to a facility, you will have a room and board charge. But if you want to do it in your home, it is free. Terry, our website is themedicarefamily.com. My husband has age 5 Alzheimer's, has Medicare insurance, went up $80 a month to $399 because he used it. It can never go up because he uses it. It has no bearing at all on how healthy or how sick he is. It's going up, and it'll go up again next year for a variety of reasons, but it has nothing to do with his individual health. Especially with Alzheimer's, that you don't go to the doctor a lot. It's not like kidney failure where you got to go into dialysis 3 times a week. So a lot of people on Alzheimer's are surprised that Medicare Advantage is affordable, and it's okay. I need an agent to get better coverage in open season. Susie, that's what we can do. You have to wait until October to book an appointment. Go to our website, themedicarefamily.com. We'll help you. If you haven't signed up for Medicare right at 65, we'll turn 66 in October. I need to know why you didn't sign up. If you didn't sign up because you were still working, your company had 20 or more employees, we don't have a problem. No late penalty, no problem. If you didn't sign up because you were healthy and you didn't want it, you're like, I don't need it. Now we have a problem. You cannot sign up until January. It will not begin until February 1st. So I need to know your specific situation. If you want to email my team, your exact details, we can give you a little better guidance. This is our email. hello@themedicarefamily.com. So hello@themedicarefamily.com. Can I claim? Don't email us about Social Security, estate planning, only about Medicare, please. Sarah, if you're a disabled widow, when I turn 60, can I draw for my husband's full Social Security? No, you have to be at your full retirement age. You'll get a permanently reduced amount. If you draw at 60 as a widow, you will get 71.5% locked in level for life. Do not do that unless you understand that it's not going up when you get older. Can you still work and get Medicare insurance? You can. A lot of people don't have good insurance at work. They like their job, but their insurance not good. Deductible, $3,000, $4,000, $5,000. So they go to Medicare at 65. You can still work. Is Freedom a good insurance option for Medicare? I'm turning 65 and I'm already on regular Social Security. Terry, Freedom's only in a couple areas. First of all, they're a very, very small company, but I think they do a good job in Florida. If you're in Florida, but even if I said Freedom is a good company, which they are in Florida, doesn't mean they cover your doctors or your hospitals. So we want to do our process. We want to start by talking to you personally about your specific situation. Then we get your zip code. Then we start looking at plans available in your area, and we try to overlap your drugs, your hospitals with plans that are available and give you a recommendation. But yeah, I'm okay with Freedom. If you need an appointment, just go to our website. It's free. Our help is free. We're paid by the insurance companies. Go to themedicarefamily.com. That's our website, .com. There's a little yellow box at the top of the page. Book a free appointment. We will help you. I will definitely be contacting you, Terry. Oh, yeah. I'm almost at 100,000 likes, you guys. Go ahead. I've been Tap it. We're really close to getting 100,000 likes. I'm at 92,000 likes. I forgot about that. I've been talking for how long here? How long? An hour and 26 minutes. Woo! I'm tired. Yeah, let me at least hit my little goals, which don't mean anything. I don't know. What if I live in Idaho half the time, in Florida the other half the time? Sparky, I need to know what you have declared as your state of domicile. What'd you tell the feds? Where are you filing your federal income taxes? Are you a Florida resident? I'm assuming, because there's no Florida state tax, but I don't know. If you're spending 6 months in each, it's your choice. And it's not as simple as like, well, I own a car and I license it in Idaho, but I vote in Florida. You can have many different indicators for residency, and it's going to come down to what you claim. If you spend 6 and 6, then it's what did you tell the government? Hi, honey. Oh, let me see here. Oh, we hit 100. Thank you. Terry, yes, Florida. My big sister hasn't recommended it. Yeah, it's good in Florida. Scotty in Wyoming at 65 in December, already on Social Security, automatically signed up for Medicare, but when do I sign up for G? 3 months before. So right now, September. We want to do it right now because the government's slow. The insurance companies are slow. So if you already have do you have your red, white, and blue Medicare card? If you have your number, then we definitely get it all done right now so that it will all start December the 1st. Now, this is the wacky thing about having a birthday in December. You're going to be on a drug plan for 1 month of 2025. That plan will change to a different plan with a different price, a different everything, starting for 2026. It's a little bit mind-blowing, but I didn't make up this system. Your Medicare supplement, you're good. As long as you pay your premium, you'll have your supplement for the rest of your life. They'll never change your benefits. Hi, honey. Who are you talking to? Yeah. If you need an appointment, just go to our website, themedicarefamily.com. Sparky, Florida. That's what I figured. If you go to our website, themedicarefamily.com, the yellow box is like right here. It says book an appointment now. But if you're on a mobile, it might be someplace different. If you don't have my book and you want to get ready for Medicare and you want to, get prepared, Medicare or Social Security, head on over to Amazon. In the Amazon search bar, type in Medicare space mama, MAMA. The government doesn't care if you mess up. They don't care if you get late penalties. It puts more money in their pocket. They do not care. It's not their job to educate you. They're not allowed by law to give you advice. And as much as they could be more helpful, they're kind of in a bad position being understaffed and overstressed. So you might not get the right information from them to begin with. So I wrote the book to help you guys. I can't read it to you. I can't read it to you, but I can write it for you. Go to Amazon, type in Medicare Mama. You'll have it in 3 days. Medicare started September 1st. Will the premium be deducted from Social Security? Medicare Part B premium will be deducted. Does TRICARE for Life automatically sign me up for Medicare? Nope. You have to do it yourself or your TRICARE for Life will terminate. We hit 100,000. Vico, thank you guys. I appreciate you. 60 in November. Do I qualify for Social Security? Only if you are a qualified widow. I turned 65 in October. I haven't done anything. Denise, do you need to do anything? So if you are working or you're on your spouse's insurance and there's more than 20 employees and you want to stay there, you don't have to do anything. If you're like, no, I'm not working or I'm going to quit in October, then you do need to do something. So if you do need to do something, we'll walk you through the process. Go to our website, themedicarefamily.com, book an appointment. We'll call you. We'll walk you through it. My mom has been on disability and is turning 65. Does she need to do anything? Yes, she very much does. She needs to book an appointment with us. We can explain that she gets a second entry into Medicare, which can be very beneficial. Most people on disability don't know that. So you're a good child for helping your mom. Help her book an appointment on our website 3 months before she turns 65. Brad, they will send your Medicare card to your address that you have on file with Social Security. Does Medicaid assist a senior citizen with senior living facilities? Skilled nursing facility, there's Medicaid will pay if you do not have any funds to pay for yourself. Will Medicare coverage be harder to cover when I'm in a different state? Sparky, if you were talking about Medicare Advantage and you're moving to a rural part of Idaho, Montana, South Dakota, Wyoming, yeah. Actually, the whole state of Maryland, New Hampshire, yeah, it could be very hard. This is going to be a hard year where there's going to be areas, many more areas where you can't even get Medicare Advantage plans. But you can buy a Medicare supplement plan in any state. You can buy a drug plan in any state. In Texas, my 60-year-old spouse has been getting disability for 5 years. I'm 54. You cannot draw spousal benefits until you are 62. If your mom needs Medicaid, you can apply with your state through Medicaid. At your full retirement age, you can make all the money you want. There's no income limit. Social Security does not care. Once you reach your full retirement age, you go out and you can earn any type of money from any type of source. There's no longer a conflict where they might lower your Social Security. That's called the earned income limit. That can be very severe if you're under your full retirement age, which is based on the year you were born. If you don't know what that is, get my free Social Security and Medicare cheat sheet. It will tell you that and lots of other deadlines and fantastic information. Click on my face up here with the pink circle. Click on my face until it makes my face pop up in the bottom third. Click on that a couple times. Then you'll put in your email. You will get this. I will update it every December for the numbers for 2026. Anybody that bought my book, Medicare Mama's Guide to Medicare and Social Security Retirement, that QR code is in the front of the book. That will already have the updates for Medicare Part B, the Part B deductible, the Part D deductible, the Part D maximum. It's already updated. Just go to the QR code and you can get it. Jennifer followed me. Thank you so much. Is it a good idea to get disability lawyer before you apply? A lot of disability lawyers will tell you to go apply on your own. Go to socialsecurity.gov, apply, wait the 9-10 months, get declined, and then hire the disability attorney because you've already sped the process up. Is the cheat sheet in the book? The cheat sheet is not in the book. Different parts of the cheat sheet, like the tax part is in the tax chapter. The IRMA part is in the IRMA chapter. But it's not like the cheat sheet entirely set up in the book. Hubby retired civil service. We have insurance through his Blue Cross. Also have A and B. Can we drop B? Yeah, you don't need it. It's not required. It could give you a little benefit, but it's very expensive to have your federal Blue Cross and Medicare Part B. If you're not sick, it's just a lot of money. When you turn 67, can you take out your 401k and stocks without getting a penalty? There's no penalty, tax penalty, for taking money out of your 401k as long as you're 59 and a half. Now you're going to pay taxes on it, and the taxes can drive up Medicare, and that can happen at any age. So if you do it at 67, it can impact what you pay for Medicare at 69 because Medicare IRMA is always looking back 2 years. Carol, I was approved for disability, first time applied without any lawyer. I don't like to give people that false hope because it's very rare and very hard, but good for you. I'm happy you got through that. Most people will get declined at least once or twice. So I tried to get people realistic expectations. So it doesn't, it's not a fast process. There are about 250 conditions that are fast tracked. Where you get seen faster. But, for a lot of them, it is going to be a multi-year process. You guys learned something tonight? Share it with your friends, your family, your neighbors, anybody on Facebook. Tell people stuff. Tell them just one tiny little thing. Help somebody else. Nobody knows this stuff. You are now the smartest person in your friend group because they do not know this stuff. Even if they're a financial planner or an accountant or an attorney, especially those guys, they don't know this Medicare stuff. Nobody learns Medicare until they have to learn it, which is right here drinking from the fire hose when you're on the cusp of needing it. So if I didn't get to your question and it's about Medicare only, you can email it to my team. They answer the emails every day. So email hello, HELLO, at themedicarefamily.com. We'll be happy to answer that. If you need an appointment to talk about your Medicare, you need help, book in a free appointment. Our help is free. We're licensed in all 50 states. We will help you. We're not affiliated with the government. We're a small family business in central Indiana, and we're licensed wherever you are, all 50 states. Thank you guys for joining me tonight. Yep. Oh, that chili was good.
Did you have some? So there's lots. 30,000. Wow. You were only on for like an hour and a half.
Hour and 36. But it's really too much. It's really killing my throat. But I did so many lives last week that Elliot was booked at 98% appointment. So it's like, it works.
Yeah. Ooh. I'm going to eat here before I let the dogs in because then they'll just beg. Did you make 78 cents?
No, I made $2.41.
$2.41.
That's like a really lot.
Yep, that is a lot. That kind of money opens up a whole bunch of new options.
People keep asking me, should I take my Social Security at 62? I'm like, girl, I don't know you. I don't know.
If you're struggling with low views and first page impressions on your Airbnb property, I'm here to reassure you. It's the way you're looking online.
As you're 23 years old and you're pregnant with your first child, everything's going on. Everything's free, you're healthy, you're going to all your prenatal appointments, you're getting your ultrasounds, there's absolutely no problems in pregnancy. You wake up at 5:30 in the hospital in a water room, so your husband rushed immediately to the hospital, excited, happy, whole entire 4 weeks, waiting to give birth. You get there, nothing else to you. Your baby's heart rate on the heart monitor keeps dropping continuously. Your baby's having what we call decelerations in the heart rate, which can be a sign of fetal distress for a number of reasons, and more specifically, most often, a sign of a lack of oxygen during labor. This is going on hour after hour after hour after hour while your baby loses oxygen, and you know that you want IV pain meds instead, and you're told that heart rate's been dropping too much. You don't know what that means, but you're trusting everybody to handle things. On top of this, classic signs and symptoms indicative of a diagnosis of what we call preeclampsia, which is a life-threatening condition that maybe a mother. You have elevated blood pressure, edema, swelling, headache, and nausea. You are not given magnesium, which is the standard of care treatment for medication for preeclampsia, and you are simply allowed to continue laboring. And on top of that, you are given pitocin, which is some augments labor, makes things move faster, makes your contractions stronger. All the while, your baby's heart rate drops. Eventually, your child is born. Almost 24 hours after you first arrive at the hospital, she is not moving, she is not crying, she is not making any sound, she is whisked away from you by nurses who look scared and panicked. She's taken away from you. Everything's a blur, everything's moving so fast and also so slow at the same time. And all of a sudden you're told that there's a problem and that she needs a higher level of care, and you're transferred to another hospital that has a higher level of care, where she's given what we call cooling therapy, where they hook your baby up to cooling blankets when there's concern that they may have a brain injury.
This is massive. Yesterday, the UK witnessed one of the largest protests of its kind in modern day history. There were Charlie Kirk tributes, Elon Musk, counter-protests, wooden crosses, peace, violence, and a whole lot of British flags. It was called.
I mean, there's a hole over there that didn't have anything in it.
That was for you.
Oh, thank you. I thought you just didn't get a chance to eat yours.
I left the chili out in the bowl. Corn. Did you have your corn?
No, not yet.
I'll have the corn, honey. It's good. It's good corn.